Okay, so hopefully our last video for the GI drugs. We have it's called a substance P. It's a neurokinin 1 antagonist, and also referred to as amend. It's a new drug for preventing post-op nausea and vomiting with our chemo-induced nausea and vomiting. Mechanism of action is just what it says. It's an antagonist, so it's going to block the neurokinin 1 type receptors in that chemo receptor trigger zone. It can enhance responses when combined with other antiemetic drugs. So again, they're probably going to be giving this apripitant or amend with Zofran or one of the other ones, such as that. Has a prolonged duration of action more than the other ones because it's newer. It can be used alone for post-op nausea and vomiting. Needs to be used with a combination. Everything's always combined with chemo-induced nausea and vomiting. Usually with that, we're going to be using Decadron, the glucocorticoid, or the serotonin antagonist, Zofran. And then we would be remiss with the gut without talking about drugs for motion sickness, because that can definitely cause true nausea in anybody that experiences it. It can be caused by sea, air, a car, and space travel. Symptoms: nausea, vomiting, very, very sweating, and you get pale. It's a horrible feeling. If anybody in here, I used to get very car sick in the mountains. Drug therapy is most effective when given prophylactically, so before it goes on. My dad, who's never had this in his entire life, as we're driving him around to all of these appointments with different doctors, he's been getting very nauseated in the car. I mean, it's just been unbelievable because he's never been like that. And then I started to think about it. Well, he's always driving, and now he's not driving. So maybe that has something to do with it. But anyway, we now give him scopolamine. It's a little scopolamine patch that we put behind his ear. And so we've been putting him on, been giving him that before we put him in the car. So again, prophylactically, suppresses nerve traffic in the neuronal pathway that connects that vestibular apparatus in the ear of the inner ear to the vomiting center. Scopolamine's a very old drug. I think I have it over here too. Yeah. Common side effects, just like a lot of these that stop a lot of the liquid in your gut. It dries everything. So dry mouth, blurred vision, and drowsiness. I've seen the dry mouth and the drowsiness much more than I have the blurred vision. You can give it a PO sub-Q, and we've done the transdermal behind the ear because we don't have to mess with. Number one, we don't want to poke him. We're in the home, and he doesn't need anything else orally, so that's what we do. Antihistamine, same thing. Dramamine's an old one. Antivert. They block receptors for the histamine H1 and muscarinic cholinergic receptors in the nerve pathway that connects the inner ear to the vomiting center. Prominent side effect for all of these is sedation. Other side effects: dry mouth, again, blurred vision, some urinary retention, and constipation. And this one is less effective than scopolamine. Both of them are. Scopolamine is the better drug. And then we're going to talk about our antidiarrheal agents, because we talked a lot about the constipation. And believe it or not, opioids are our most effective antidiarrheal agents. What do we talk about when we give an opioid? We talk about constipation, constipation, constipation. So obviously, we could use it for diarrhea because we know it's going to stop everything up. Decrease intestinal motility. Diphenoxylate opioid used only for diarrhea. It's best known as Lomotil. And you're like, an opioid for diarrhea? Well, the beauty of it is there's very, very low incidence of abuse, and you can buy it at CVS or Rite Aid or Walmart. Again, best known as Lomotil, 2.5 milligrams of this drug, Lomotil or diphenoxylate, and 2.5 milligrams of atropine sulfate, which is like a drying agent. Atropine is an antihistamine properties. Atropine is basically uses that there is no abuse with this drug. Doses of the drug. Remember how we talked about antagonists and agonists? Well, atropine would be that antagonist, where Lomotil is probably agonist-antagonist. So they put atropine with Lomotil. It's used so that there's no abuse with this drug. Doses of the drug that are high enough to produce euphoria would produce unpleasant side effects from the high dose of atropine. So there's very low incidence of abuse with Lomotil because they put atropine with it. That's what that basically is saying. Imodium is a structural analog to meperidine, which is Demerol. Drugs used also to treat diarrhea and to reduce the volume of discharge from ileostomies because it's all liquid at that level. Colostomy, you have a little bit lower in the colon, you have a little bit more stool. And an ileostomy, because it's so high up, you have it's all runny. It's poorly absorbed and does not cross the blood-brain barrier. Very large doses do not elicit a morphine-like subjective effects. It has little or no potential for abuse. And Imodium is another one that you can buy over the counter for diarrhea. And irritable bowel syndrome, I think I talked a lot about this in the other. So let's see, we don't need to talk. It's 3 times the incidence of men. Okay. Non-specific drugs, antispasmodic, bulk-forming agents, antidiarrheals. It just depends on what's going on because, again, it says studies suggest there's no proof that any of these work and that antibiotics or acid suppressants have helped with symptoms, but it just depends on what's going on with irritable bowel syndrome. And you can see how it's defined, what they say. And drugs for inflammatory bowel disease, Crohn's, we know that that's just by inflammation. But it's all parts of the GI tract, where ulcerative colitis, it's just the colon and the rectum. And drugs for irritable bowel disease would be our aminosalicylates, our glucocorticoids, again for inflammation, overall well-being, immunosuppressants, immunomodulators, antibiotics, and none of them are curative for irritable bowel or colitis or Crohn's. It's just trying to manage or control the disease. Let's see. Sulfasalazine, azulfidine belongs to the same family as the sulfonamide antibiotics. Not used as an antibiotic here. It actually helps reduce inflammation. And I think in the other PowerPoint I have for the GI diseases, it says anti-inflammatory, glucocorticoids, and you know darn well that these are really, really strong diseases that they would be using a glucocorticoid. They would never use that for like an ulcer unless it's a crater. Immunomodulator helps put Crohn's disease in remission and also has helped out ulcerative colitis. Immunoinflammatory modulator. Some patients can have very severe side effects, such as they can contract tuberculosis and other opportunistic infections because they're using glucocorticoids, immunomodulators. So again, we have to handle these people we have to teach everybody in the family to wash their hands. And if they have a cold, they can't be around them or they have to wear a mask. And then nicotine, well, I have a question mark there. Known fact that ulcerative colitis occurs mainly in non-smokers, but this disease can happen after smoking has stopped. And as soon as the patient starts smoking, it subsides, but it's not recommended for treatment. Okay. I think that's it. All right, that will end our discussion on GI meds. GI meds basically, again, is for inflammation. It depends on what's going on with the patient and ulcers. And the key thing to remember about ulcers is the new finding in the last, 10 years especially, is we are going to treat ulcers with antibiotics. All right, I will see you next time in class. I hope you have a great week.